Here's what I found from the web. Alexa, Obi-Wan can stop.
Oh, what happened here?
Mike, I see a message that we are now live streaming.
We are live streaming.
All right, should I go ahead and get started?
Sure can.
We have a quorum. Well, good evening, everyone. And I'm going to call the Skokie Board of Health meeting for Thursday, March 10th, 2022 to order. And before we begin, I need to read a statement since we're meeting virtually. Due to the surge in COVID-19 cases, this meeting is being held virtually. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie at michael.charlie@skokie.org. And all properly submitted statements or questions will be presented to the Board of Health members and be made part of the record. Written comments may also be submitted by email to publiccomments@skokie.org or by mail to the Village of Skokie. Attention, Michael Charlie with the Skokie Health Department, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's Dropbox located by the public entrance to Village Hall. And with that, we use a consensus approach for approving our agenda. Is there any item to extract from the agenda? Seeing none, then the agenda is approved. And likewise with the minutes, we use a consent approach for the minutes. Any item to extract from the February minutes for discussion? I don't see any hands raised, so the minutes are approved. And we have a couple of guests. Mike, are you going to introduce the guests for tonight?
Yeah, I can. So we have two guests tonight. We have Mark Schroeder. He's from North Shore Hospital System, and what's your title, Mark? Community engagement.
Manager of Community Relations.
Okay, Manager of Community Relations. And we also have Kim, and I don't know if I'm going to get your last name right, but Shifras?
Yeah.
And she's a CPA, and her firm has been hired to coordinate the North Shore's community health needs assessment process. And I've met, I've known Mark, I think I walked through the door at Skokie back in November of 2020, and Mark was the first person to call me and welcome me to the community. And I meet with Mark and others from North Shore routinely. And then Kim and I have met a couple times because I've participated in some groups that have assisted them with their plans so far, answered some questions, some focus groups. So they'll be speaking and providing an update on where they're at with their community health needs assessment. And I think that you'll find that a lot of what they're doing is sort of similar to what we've done in the past and we'll be doing soon. So thanks for being here. Really appreciate it.
Yeah, welcome. Thank you. I should note also that Trustee Robinson is joining us tonight. So good to see you. Thank you. I have an item for my report, and that is a recent APHA webinar. And I've got a PowerPoint, Mike, if you can pull that up.
Yep.
You know, last month we talked about a webinar that the American Public Health Association and the National Academy of Medicine presented on what we've learned from the COVID pandemic over the last 2 years. It was kind of looking back and looking at where we are. Recently, the American Public Health Association had a webinar called Keeping Our Communities Safe and Thriving, the Role of Public Health. And I just want to bring out a couple of highlights from that because I think it's important as we now look forward to where we are with public health and dealing not only with COVID, but all the other challenges that we have in public health. So if you could advance to the next slide. So what's the role of public health? The future of public health after COVID, and where do we stand? And how do we respond to equitably distributing things like testing, vaccines, medicines, and funding? These are challenges going forward. We've been tested over the last 2 years with regard to people having access to the vaccines, and the challenge going forward now will be with medication as we get effective antivirals. Something that took up quite a bit of discussion at the webinar was the authority to act in public health emergencies. And there's been a real concern that judicial, executive orders, and legislative restrictions on mandates for things such as masking and vaccinations may actually handicap public health departments going forward if we have another surge of COVID or the next time another pandemic makes its rounds. And how do we deal with things where we are restricted in terms of what we can do? And it's not something to solve tonight, but it is something that should be on the radar. Another thing that has become apparent is distrust of public health and polarization over evidence-based practices such as masking and vaccinations. Mm-hmm. And then the fact that there have been mixed messages coming out of the public health community. There's a concern that we need to have speak more collaboratively and with one voice in terms of how we advise the public about protecting themselves and their families during a public health emergency. Next slide. And part of that is the education that public health is public safety around things such as infection control, food and water safety, which I know, Mike, is a big part of the Skokie Health Department. Environmental safety, things such as lead exposure, rodent and pest controls. So that the public realizes that we are here to protect them and not to antagonize them or take their freedoms away, as has been talked about in the press. Last slide. It's become apparent also that health and the economy are linked. Certainly the economy took a hit when this pandemic got started 2 years ago, and we're going to, I think, continue to see issues around how we deal in the economy when we have a stressor like a pandemic. One thing that became apparent is that we need to standardize data collection and reporting. There are gaps, there are streamlined collection. I know we've been working with the Illinois Department of Public Health to get numbers collected, and then how do we analyze that and how do we get that out to the public? So the public would understand that this is what we're trying to tell them in terms of risk management with regard to infectious disease. Something that is important is there be a national response with local implementation. And here I'd like to highlight the Medical Reserve Corps that we have in Skokie, where when we had to do the mass vaccination COVID clinics, the MRC was there to carry that out. And I think that is a compliment to what the health department has done in really being mobilized for a local response when there is an emergency. Someone's talking? Finally, and I'm so glad our friends from North Shore are here. We need to integrate public health with the healthcare system. We can't be in two separate arenas. We need to work together. It's going to be great to find out how we can support each other. And then we need to be a source of credible information. I think the weekly Skokie e-news that comes out has been a great source for that. Updating where we are with the pandemic, getting information out about vaccinations and testing. So I think it's important that we continue those efforts. And I'd be happy to take any questions.
I'm not sure who it might be that whoever's on the iPhone, maybe. Because everyone else is muted. I'm trying to figure out if I can mute them. Hold on 1 second.
Okay.
It looks like Larry Williams because it's lighting up.
Okay, hold on. Are you done with your presentation then? So I'll stop.
Yeah, I am finished. Yeah. As I said, I'd be happy to take any questions or comments. Okay, I'm not seeing any. So, Mike, you want to go on your portion?
Yeah, so next on the agenda actually was North Shore, Kim and Mark to talk about their health system community health assessment process overview. I know Kim has some slides she'd like to share.
Mark, you want me to go ahead and share the slide deck?
If I could just lead off though, Again, Mark Schroeder with North Shore University Health System. I'm the community relations manager with responsibility for our Skokie and Evanston hospitals. We are very fortunate to have two public health departments in two of our hospital-based communities. And we work very closely throughout the year. Mike's on our community advisory committee. I serve on the village's, their health advisory committee. We speak often. And going back to what Dr. Warner was talking about is working collaboratively, even during the pandemic. We were in often communication with Mike and his team, offering to go out and do vaccinations into the community, providing education through a lot of various channels. So we're very happy and pleased and proud of the relationship that we've maintained for all my 16 years with the village of Skokie and its health department. With that, all nonprofit hospitals are required to conduct a community health needs assessment every 3 years, and we are in the process of doing that now. We have retained Crow as our consultant to help lead that process. I want to thank Kim for joining us tonight and taking time from her evening to give a brief overview of the process that we're currently going through. So Kim, I'll take it over to you.
Doesn't he sound awful?
Thank you. It's great to be with you tonight. Can you confirm, Mark, that you can see the North Shore slide deck?
Yes, I can see it.
Okay, great. Well, yes, again, thank you for having us with you tonight. Like Mark said, really we just want to give you an update on where we are with the process and an overview of the process that we're undergoing in regards to the community health needs assessment for 2022. So 2022 is a busy year. Once the Affordable Care Act was passed, as you know, as part of that, it requires nonprofit hospitals to conduct community health needs assessments once every 3 years. And the IRS, there are tax regulations in 501(r)(3) of under the Internal Revenue Code that specify the requirements as far as what must be done as part of the assessment and what must be included in the CHNA report that is issued every 3 years. So with that said, the process that we're working through with the CHNA process that we're working through with North Shore for 2022 is aimed at having overall compliance with the regulations, as well as providing meaningful information for North Shore to develop a plan to improve community health and quality of life for the residents. So here on the slide, on the first slide, is just a timeline of our process. So we started the process with North Shore as a team. We started collaborating last October and November with planning. We have assisted them with the 2019 Community Health Needs Assessment as well. So we have gained familiarity with the community and with North Shore in this process. And so we discussed the community, any changes that we would want to implement with this cycle of community health needs assessments, and identified the community. Once we agreed what the community would be, we pulled initial secondary data regarding demographics and socioeconomic information, and also health indicator data. So we've taken a look at that, and that has been pulled, and we've analyzed that. But just as importantly, and I would say more importantly as part of this process for hospitals, is the collection of primary data. So North Shore has gone, part of our methodology and process, we've conducted a series of 5 focus groups, and those focus groups were conducted in January of 2022. Those were conducted over Zoom, but they were quite robust. We had 5 facilitators on the line to facilitate those each of those focus groups, and we gained a lot of valuable input from community stakeholders. Community stakeholders represent a wide variety of organizations representing the community, including public health, which is a required, is one of the requirements of the CHNA under the IRS regulations, is that public health, input from public health must be obtained as part of this process. it's aimed at encouraging that collaboration. We have also disseminated a community health survey, and that was distributed, an electronic survey communicated to the community and distributed, and has been ongoing since late January of 2022. The survey was distributed in both English and Spanish, and we still have that survey open, but we are on the tail end of that survey. So we've started to pull together the CHNA report, and here the yellow line really tells us where we're at. North Shore, part of the requirements is that you really do have to look back and report out. So as part of the process, the assessment is going to be done, and then North Shore will develop an implementation strategy. They will, needs, we identify the broad range of needs. North Shore will undergo a prioritization process to prioritize those needs, and then they develop a plan to respond to those needs. So there is a reporting out, and that has been done as well. So we're really ready to, we're on the tail end of this process. So just a little bit more detail regarding some of the specifics regarding the needs assessment for 2022. So that listed here are the 52 zip codes that represent the CHNA community for the North Shore the four North Shore hospitals who are conducting the joint community health needs assessment. And Skokie is represented here in the Cook County North suburbs. So we collect data for the village of Skokie as part of this process. I had said we had gotten primary input, and so I'd like to elaborate on that just a little bit more. For the focus groups, like I said, we had 5 focus groups. We asked questions. So what did we ask? What did we solicit input on? We wanted to find out input regarding what factors are impacting the health of the community. We wanted to identify those underserved and most vulnerable persons in the community. We wanted to address any barriers to addressing the health needs. We found out some of the underlying social determinants of health. We gathered information regarding what factors, such as education, employment, housing, which impact health, as we know, to a great extent. Which of those are the most significant, and are there any significant needs in those areas as well? And then identifying the most significant unmet health needs. Related to the survey, as I said, it was provided and distributed in both English and Spanish. As of Tuesday, when I pulled the slides together, there were 896 completed surveys in English and 30 completed surveys in Spanish. The surveys completed for the village of Skokie, so for the 3 zip codes here, we have 202 completed surveys as of Tuesday. And a lot of effort has been made to distribute the survey. And Mark, you maybe want to add a little bit of information here, but in order to get input from all populations, I know extra effort has been taken to get the input from the Spanish or the Hispanic population, as well as signs were and communications out to like Erie and the health clinics. Mark, I don't know if you have anything else to add there as far as getting that input.
Yes, we counted on a lot of our community partners that volunteered to help us distribute that. The village of Skokie put that in their e-newsletter as well as in Evanston. So it was also information was placed at Heartland, the federally qualified health center in Skokie, as well as the Erie Evanston. So we made a concentrated effort to make sure that there was a broad distribution of the survey to those that we, kind of targeted at the underserved, but to broadly distribute it. So I think we did a really good job of that. And again, we also used our North Shore patient base to provide the opportunity for our patients to participate, as well as our employees. So I think we did the best job we could. I think we didn't leave any stone unturned to try to give people the opportunity to participate.
Yes, and we have double the surveys, more than double the surveys that were completed in 2019 as of this point. So we're pleased. I mean, it's the survey, the community survey. It's not required. It's not a statistically valid, survey. Those are very costly, and that's not a requirement under the 501(r) regulations. But we are looking for community input. We want to give the community a voice, and we're looking for thoughts and opinions. So what's our next steps? Last slide here. We're getting ready. Once we determine that we'll close the survey, which we'll be discussing that next week. Once the survey is closed, we will summarize those results, and the draft of the CHNA report will be finalized. We will finalize that list of identified health needs. So from all the data that we've reviewed, all of this input that we've obtained, we will prepare that listing of identified health needs. At that point, North Shore leadership will review the CHNA report and findings, and they will implement a process to prioritize health needs. So they will select a subset of the identified needs for which to focus on the next 3 years. And then the CHNA report will be finalized and issued. That all will need to be done by September 30th. Of 2022. So that will be reporting, and prioritization will be occurring here later this spring into summer. And then the last part of that is part of the CHNA, but like I said on the first slide, then the next part will be, they will be developing an implementation strategy to respond to those needs.
If I could just add another thing is that I think what public health as well as hospitals are recognizing, and our focus will be, which was really different from the previous community health needs assessment, is our focus is going to be on the social determinants of health, to really work to address those. It's somewhat of an industry focus right now that is really to address the root causes of what become health issues. So you'll see a focus on that this time around.
Yeah.
I have a question.
Sure.
The pandemic has exacerbated concerns around mental health issues, substance abuse issues. Was that measured in the survey?
Yes, and as of right now, it's easily the #1 identified health need.
Yeah, it is easily, and I do needs assessments across the country, and in every community. You started to see that in 2019 CHNAs, but mental health is top of list for and substance abuse, every community pretty much that I'm working with. It's one of the top 2 to 3, but usually it's the top 1.
Yeah, and it's underfunded as well.
Yeah.
Under-resourced. Yeah. All right.
Any other questions?
We would just like to thank the health board for inviting us to present this. We appreciate the opportunity. We work closely with your health department. And again, thank you for the opportunity to make the presentation tonight.
Yes, and thank you. And Mike and I thought it is important to get input from the community providers for the Board of Health, so we know really what's available for our community. So thank you very much.
You're welcome.
Thank you guys so much. Thank you, Mark. Thank you, Kim.
Thanks.
And you guys can stick around if you want, but there's, no pressure. I know it's at nighttime, and I don't know what TV's on Thursday night. I don't know. Okay.
All right. Good night.
Okay. Thank
All
you
right.
so much. Okay.
Good night. Hey, Mike, if you want to continue with your report.
Yep. Sure. Okay. Let me just pull up my presentation.
Yeah, we see it.
You see it. Okay, good. Let me just minimize my thing here. Okay, so for tonight, I have some updates for the group. So first I want to talk like I have been in the past, although I hope that with the cases decreasing precipitously, I hope one day this isn't necessarily as much of a priority as it has been over the last 2 years now. But so our cases have, what's happened since the last time we met with COVID? Cases have dropped significantly. We've had, and I'll show you some data on the next few pages, but I mean, we went from a 7-day moving average in January of over 250 cases a day to just earlier this week on Monday, we were at about 4 cases a day. It's been a significant drop, not only in Skokie, but throughout the region and the state of Illinois. And I think I'll have some graphs that'll sort of show that information to the group. On February 28th, the state of Illinois lifted their mask mandate, and that sort of sent the dominoes falling. We coordinate pretty closely with Cook County Health Department and the Chicago Health Department and Evanston Health Department. I meet with them regularly, and we knew that the governor was going to be lifting the state's order. So we, as a group, using data to inform our decisions, we decided to lift Skokie's mask mandate and the proof of vaccination orders. We felt comfortable at that point with the data showing that the number of cases were dropping, to lift both of those. And so far, so good. You know, I actually, and I'll show you the data in a second, but as of Monday, I think we were at 4 cases per day, a 7-day moving average in Skokie. And I ran the data just before the meeting, and we had increased just a little bit to like 5. But in general, it's a lot less than it was during that crazy chaotic time early in January. So Skokie schools lifted their mask mandates since we last met. And I know that there was a lot of legal action through Sangamon County, and then the governor had appealed it. And the last I heard is now the governor's office is saying they have the legal authority to require masks, but they're not going to do it in schools at this point. So things have kind of ebbed and flowed. And we had one of Skokie's school districts kind of jumped on the mask optional right away. And the remaining schools, including private and public schools, have sort of trickled in. Oh, that's one other question. So yes, we've worked really closely with the schools. We're on a first name basis with the superintendents and the nurses and some of the other administrative staff that provide them consultation on these many issues. The FDA review of Pfizer vaccine for children 6 months to 4 years is delayed. You know, some of the data coming out wasn't very supportive of supporting administering doses to that age group with the dose they were using in the study. So as far as I'm aware, you know, the FDA, Pfizer's gone back to the drawing board, and before they bring the request for emergency use back to the FDA, so only time will tell. I haven't heard anything new about a 4th booster, although they're still looking at it, both Moderna and Pfizer. On February 25th, the CDC released this new framework to monitor the level of COVID-19 in communities based on a county level data. I don't know if you guys remember, but there was, we have used something called the community transmission level or rate. And that was sort of if it was above 100, it would be considered high. 100 new cases over the last 7 days per 100,000 population. Well, this new framework takes this into consideration, but they sort of have shifted, and I have some, to using hospitalizations, hospital capacity, and cases by county to define whether or not that county is low, medium, or high risk. Now, this sort of, and I can share this presentation if anyone's interested afterwards, or you can just go to the website and Google it pretty quickly. But this is sort of a matrix that they're using. And I think the states and other health departments are starting, this is sort of transitioning from a pandemic model to an endemic model, right? I think that we figured out that we can't continue to use the old community transmission rate and say, hey, if it's above 100, it's high, we all have to mask. Because if our cases are still relatively low and our hospitals aren't overwhelmed, then I think that the CDC has decided to loosen some of the restrictions. So as you can see here, if you're looking at this matrix, that on the left-hand column, if the community transmission rate is below 200, and the new COVID admissions per 100,000 population is less than 10, and the percent staffed inpatient hospital beds occupied by COVID patients is less than 10%, then the CDC is saying that's considered low risk or a low level. And then you can see in the matrix as the data trends in the opposite direction and or the community transmission rate increases, then you get to a point where then it's considered more a medium and high risk to the community. This is a map of the United States, and the green represents low, yellow medium, and orange high. So there certainly still are parts of the country which the CDC would recommend masking and recommend testing and recommend using mitigation measures, a layered mitigation approach. In the Chicago area and Cook County and most of northeastern Illinois, that's not the case right now. This is just an idea. Now, what I did here, and I hope I'm going to try to make sense of this, although each and every one of you, I always say that the website can probably, I'm not doing the website justice in my presentation here, but the CDC, for each level, they provide both individual and community intervention mitigation strategies. So if you're at the low risk, they're saying stay up to date with vaccinations and follow isolation and quarantine. They're not recommending masking. They're not doing as much as recommending that those people who may be at an elevated risk or more vulnerable always wear masks when they're out in public. But as soon as you move up to the medium level, then they're recommending that the immunocompromised consider wearing a mask. If you're visiting someone that's immunocompromised, that you wear a mask, even if you're not. And this is just a snapshot. There's a lot, there's a lot more on the website on this. There's like many different recommendations for individuals and at a county level. And then at a high level, now they're going to say, now you need to wear a tight fitting mask in the public, regardless of vaccination status. And if you're immunocompromised or high risk, just stop visiting those high risk places. So this is sort of where we're transitioning, I think, as long as we stay at a pandemic level and COVID is more like, I'm not going to say it's like the flu, but in regards to its pattern of transmission and how often we're seeing it, this is where I think we're heading, is to more of like a flu model than a pandemic COVID model. So I'm going to transition a little bit to some vaccine updates. So we're still vaccinating individuals, but we've transitioned our clinic from over at Erie Crown over to our offices. I just want to thank anybody who was on the Board of Health who's participated in the Medical Reserve Corps. Thank you. I know I just recently saw Dr. Lynn vaccinating people. And I really enjoy observing like Dr. Lynn and others and what you guys do. You're just so amazing. And we couldn't have done this without you. Actually, Claudia Braden, our MRC and emergency preparedness individual with the health department, ran some numbers in regards to if we would have had to hire comparable staff to participate in our clinics, we would have spent about, I'll provide the number at the next meeting, but it was something in the effect of like $750,000 minimum to pay for all of that staffing. So we're in debt to the MRC volunteers. We have administered 32,718 doses through today. Skokie case data. So I just took this directly off our website. This is a couple days old, but we have about almost 15,000 cases, 203 deaths, and our positivity rate is only 0.34%. Really the lowest that I can remember in a long time in regards to test positivity. This graph is a representation of the number of the 7-day moving average cases. So you add up the last 7 days and you divide it by 7. And as you can see over to the far right, we are as low right now as we have been since about mid-July of 2021. And if you look, like when we had the Delta variant, it was a slower moving variant, right? It took a while to get through the population, but Omicron had that significant spike and then a significant decrease. So we're certainly trending in the right direction. This is the community transmission rate. Somebody have a question? So this is our community transmission rate. So anything in red is considered high. Orange, which is difficult to differentiate, is substantial. Yellow, medium, and then or moderate, and blue is low. This is just information on individuals that are fully vaccinated. There is the line on top, the red line is Skokie residents, and blue is Illinois residents, and this is eligible too. Because certainly the 6-month to 4-year-olds, they're not considered eligible yet. How many Skokie residents are boosted? Well, I ran iCare data. So iCare is the state database that contains the information on who's been vaccinated with Skokie. And I came up with 29,960 residents.
Wow.
Hey, Ruth? You gotta mute your mic.
Wow.
Sorry. And then that's about 46.2% of Skokie. That's of our entire population is technically considered boosted. So I do have some other updates outside of COVID. Bruce Jones is retired, guys. After 35 long years, Bruce retired on Friday. So that's my professional sad face because I'll really miss Bruce. When I interviewed for the job here, I knew Bruce and I had known Bruce for 20 plus years. And I remember the village manager asking me, why are you interested in this position as the director of the Skokie Health and Human Services Department? And one of the primary reasons was that I knew that I was going to start a position at a health department with somebody that has 33 plus years experience. And I knew that he would be able to burden a lot of the load and onboard me to the things I didn't know about processes and procedures. So I'm going to really miss Bruce. We are going to be posting his position really soon. So if you know anyone that's has an environmental background with a state certified health department, feel free to share it. A couple other position updates. Our new public health program coordinator analyst starts with us on March 21st. I'll release her name as soon as she starts. Our new social worker starts on April 4th. So both really great candidates. We're really lucky to have both of them. And I'll introduce you to them at a future meeting. The public health intern position, I shared the posting with universities and the application deadline is March 16th. We're looking for an intern to start soon and then intern all the way through the end of the year. So I think we only have a couple applications and it's probably because of the extended timeline. But hopefully we'll have an intern to help us with the I-plan process and other things. On Monday, March 7th, the village board approved us to move forward with a health inspectional services agreement. What that is that we lost a health inspector sanitarian in 2020, early 2020, and the position has been frozen. That position was responsible for food inspections, body art, like tattoo inspections, water sampling, rats, general environmental complaints, foodborne illness. And when they left, they froze it. Well, we've made the decision, and we're going to save about a little over $70,000 for the village to hire a third-party food inspection company to just do food inspections. And they'll take a little bit, like a disproportionate amount of the food inspections. So my existing 2 health inspectors, Bill and Dwayne, can focus on not only food inspections, but some of the other things we do. I did want to mention that we have that Oakton College, Community College Village partnership, this workforce training partnership, where individuals in the community can that are within a certain income level can apply to get free certificate programming. So these certificate programs are about 15 hours a piece. And we have information on our website. If you know of anyone that's interested in applying, it's free books, free tuition. It's a really great program. And then I wanted to say that last night, the 6 p.m. Channel 5 News did a feature on our co-responder program. Brian McHugh, our social worker, and Officer Kimberly Blue, our CIT trained police officer, did a wonderful job. They took the reporter on a drive, driving around the community, and it was a really good interview. If anyone has time, I recommend searching for it. And I did want to say that, we're starting to shift back to our normal programming. And one of those programs is our Vaccines for Children program, where children that qualify, that are enrolled in Medicaid, not insured, underinsured, or American Indian or Alaska Native qualify for it. And we charge a small $5 administrative fee for children to get any and all of these vaccines. Plus there's a handful more that I couldn't remember at the last minute when I was putting together the slide, but it's a really great program, and it's available by appointment for eligible children. And that, last but not least, I feel like this is one of my longer presentations, so I apologize, but I sent an email out to everybody sort of at the last minute, around maybe like 3:30 today. But I didn't get the meeting till the Public Works Director until about 2:30. So the Sustainability Commission is preparing for the village's next sustainability plan for the village. The previous plan ran from 2016 to 2021. And from what I understand, the Board of Health participated in the preparation for the previous plan or current plan. Well, an email went out earlier today from me that included the current plan and information on and some sustainability updates for the Board of Health. What I'd like and recommend the Board of Health members do is take a look at all of this, because I've been asked by the Public Works Director, Max Slanker, to invite the Board of Health to participate in this process. I don't know exactly what that will entail, but I think that if Board of Health members have an opportunity to review the existing plan and then take a look at the couple other documents that I shared, it'll help better prepare us for a future meeting when I'll have someone from the Sustainability Commission and/or someone from Public Works come in and give us a presentation and introduce us to what they would love for us to advise on when it comes to that plan. So with that said, any questions?
Mike?
Yes, sir.
Yeah, I just want to recognize Bruce Jones. When we had the hiatus between Dr. Kincannon and yourself, Bruce administratively supported the board, and he did a great job. And also at the vaccination clinics, Bruce was the go-to guy. If there was a problem, he was the problem solver. So he did a wonderful job in that area.
Mm-hmm.
I have one question. Are the Skokie schools still doing the shield testing?
The private schools are not, but the public schools are.
Okay. So if we do have a surge, we're going to pick that up.
Yes. Yeah. At least, the public schools are definitely doing it for the unvaccinated children. And I think it's at a certain point, the vaccinated children can opt in, but they're offering it.
All right. Do you want to go on then to the bicycle?
Sure. Sure. So the police department reached out to me and were asking me questions about bicycle safety. And I just wanted to remind the Board of Health that there will be a bicycle safety event on May 14th from 2 to 4 p.m. It's the Police Park District event. And I believe Okay, I know I think Dr. Lynn participated and somebody else. I can't remember who the other Board of Health member was, but if anybody's interested in participating in that event, I think last year, maybe Dr. Lynn, you can say a few words about, if you recall, what occurred last year.
So it was a very interesting event. It took place in the parking lot in front of Oakton Park, on the north side of the pool area. The police department set up a mini course to have predominantly children, what they were focusing on, ride through it with, and they were escorted and they were given pointers on how to do this safely and how to operate their bikes effectively. The local bike store, Al's, set up a tent and they were offering, it actually was very busy. They were offering very minor repairs as well as tire checks. And they donated a lot of bike gear, which was raffled off, including helmets and pumps and things like that. And we, being the Board of Health, staffed a table along with one of the police officers to instruct children on how to wear helmets correctly. And more importantly, we were helping parents understand how to adjust these helmets, because that was one of the big pushes, and we discussed this last year, was to get all young people, and as far as I'm concerned, every head in Skokie on a bike should have a helmet. And I think it was a wonderful event. And again, when was the date, Mike?
It's May 14th.
So, I'm more than willing to volunteer again. I just have to always clear these things with a higher authority when it involves the weekend. But right now my calendar looks open, so I'd be more than glad to do this. And I urge anyone else interested. I thought it was very worthwhile, and it really gave us an opportunity to interact with the public.
Maureen was there as a volunteer as well from the board?
I think she was.
Yeah.
Yeah, she's not here tonight, right?
I don't see her, no.
No, she's excused. She emailed me.
All right, Mike, are there any public comments?
There were, I can double check, but last time I checked, if you just give me 30 seconds.
Sure.
I can,
Yeah, Ed?
Yes. One, I want to thank Mike for what I consider to be a very well-written, I'm giving you the credit, Mike, in the last bulletin, kind of reminding the public that to be adequately vaccinated, to be update vaccinated, you have to have a booster, because that's really the only way to prevent acquiring Omicron. And as everyone's rejoicing now that the rates are low, I'm still very concerned that we have, at best, a 40 to 50% rate of third dose or / boosters, and that's pretty much throughout the state, and definitely in Cook County. So Skokie's not by itself, and we really see there's kind of an apathy that's setting in, that people think that they have nothing to worry about. But this isn't the reality. It's the people who are fully vaccinated and up to date with vaccination have little to worry about in terms of severe illness. But if you haven't been fully vaccinated, you can get sick. And as Bill knows, and any other physicians who have been following this, COVID is not the flu, and there seems to be long-term sequelae from it that we're just starting to understand. And I don't think anyone should be, acquiring immunity via that route. And so I would like to suggest that we keep up the vigilance in trying to remind people, and whether we need a larger campaign, some way to get the word out, because remember, these are people that have had their first 2 doses. So we know they're not against vaccination, but they just have not adequately accepted the additional dose, which is still important.
Yeah, we have to keep that before the public, I think, constantly as a reminder. Yeah. There is one note in the chat box from Dr. Kumar, who said that she's happy to volunteer at the bike event. And the time is what, 2 to 4 p.m.? That's what I have on the agenda. So thank you, Dr. Kumar. We'll have 2 outstanding physicians representing the Board of Health. All right.
I'll even run over.
Any comments, Mike?
No, there's no public comment tonight, Dr. Warner.
All right. Before we adjourn, I want to take a point of personal privilege. I've been recently diagnosed with acute myeloid leukemia. And in fact, I spent the day with my hematologist, and I'm looking at some pretty heavy duty chemotherapy coming up now over the next several weeks. So I'm going to have to work with Mike and figure out, am I going to take a leave of absence? Am I going to resign? But I've got to concentrate on my health right now. And I do covet your thoughts and prayers as we go forward. And would appreciate all your support. And it's been a pleasure working with you if I do have to step down. So thank you. With that, is there a motion to adjourn?
Well, first, I'd like to say, wish you the best. We're thinking of you.
Thanks, Thanks, Larry.
And
Of course,
I'll make the motion.
All right, is there a second? Is there a second to adjourn?
So move.
All right, all in favor, aye? Raise your hands.
Aye.
I don't see any objections, so we are adjourned. Thank you.
Okay, thanks, everyone.